We have talked a lot about heart failure with reduced ejection fraction, but one grey area in heart failure treatment is the treatment for the heart failure with preserved ejection fraction. And apart from SGLT2 inhibitors, in which the empagliflozin and dapagliflozin have trials like DELIVER and EMPEROR preserve trial, which have shown significant result, no other drug till date has shown a significant result in prevention of cardiovascular deaths and heart failure hospitalization. In fact, the ARNI was also tested in the heart failure with preserved ejection fraction in the Paragon heart failure trial. And in this trial, it was a disappointment because the primary endpoint of cardiovascular death and heart failure hospitalization was narrowly missed. But if you do the subgroup analysis and have a look at the subgroup of patients with the ejection fraction between 40 to 50, then there was a significant benefit. There was a benefit if you give ARNI to the patients in preference to enalapril in the patients with the mid-range ejection fraction between 40 to 45. And in this age group, in this ejection fraction group, probably the ARNI has a beneficial effect. And so the guidelines have also changed. The American College of Cardiology has now updated its guideline and now recommends the 4 pillars of heart failure therapy, namely the SGLT2 inhibitors, the ARNI, the MRA and beta blockers, even for the patients who are having mid-range ejection fraction. In fact, it recommends the treatment for all heart failure patients who have a reduced or less than normal ejection fraction. Also, it makes a statement that ejection fraction is a subjective assessment. One person's assessment of ejection fraction may be low. For the same ejection fraction, the other person may, or other echocardiographer may say that the ejection fraction is normal, and therefore the therapy for all heart failure should be uniform. The 4 pillars of heart failure therapy can be applied to all heart failure patients irrespective of the ejection fraction. So now for the heart failure with preserved ejection fraction patients also, ARNI can be used as a therapy.